Medications such as Ozempic and Wegovy have made the international headlines as buzz, and controversy has mounted over their weight loss properties. The key ingredient is semaglutide, used to treat diabetes for its ability to boost insulin and control blood sugar. Semaglutide also reduces hunger and makes you feel fuller for longer. Earlier this year, semaglutide was approved for use as a weight loss drug by the NHS. Here on The Rock, the GHA has confirmed to GBC it's now prescribing Ozempic as part of the bariatric program for weight loss.
The gastric bypass and the sleeve are reducing numbers of obese people, and it's effective treatment in 80% of the patients. However, we were always looking for the magic drug to make the people thinner, and Ozempic is giving us part of this effect.
Criteria for eligibility include age, body mass index, and other conditions such as diabetes and high blood pressure.
Because it's a bariatric drug, we are using the same criteria as for any other bariatric treatment, which is the surgery at the GHA. So patients should be BMI above 35 with some comorbidities like diabetes, hypertension, arthritis, sleep apnea, or BMI above 40 without these comorbidities.
The GHA says there is a concern over maintaining supplies of the drug for diabetic patients and says it's implemented measures to try and reduce the risk of a shortage. However, GBC asked 10 pharmacies and all of them reported no stock.
As far as I know, the supply in Gibraltar is being on and off for many weeks. Sometimes we have, sometimes we don't. The Spanish agency for the drugs, Agencia Española del Medicamento, is telling me there is no shortage of 0.5 and there is a small shortage of 1 milligram presentation, which is going to be sorted now in August. And this is all the info I have about supplies. And I would like to have more. But
so does the information you do have on supply influence, how many people you prescribe this to, or do you just continue to prescribe despite the ongoing supply issue?
How can I deal with this? This is a difficult question. I'm the prescriber. So I think that if the patient is coming for a drug and I can prescribe it, I'm prescribing. The other side of the business is the pharmacies and the pharmaceutical industry. Unless Novo Nordisk, which is the main company, tell us that there is no producing anymore and we cannot prescribe, how can I deal with the shortage?
On side effects, the GHA says these can include nausea and diarrhea. It says Gibraltar will follow any recommendations and guidance on side effects by the UK's Medicines and Healthcare Products Regulatory Agency. The GHA says private clinics can also offer the drug as long as the clinic has a valid business licence and the drug is prescribed by a registered doctor, adding this should be on evidence-based guidelines. Anyone found selling semaglutide illegally could face sanctions. But is there a risk it could be used for more cosmetic purposes?
We understand that there is a lack in the market of this medicine. So one of the conversations that we got with Dr. Alfonso Antequera was that we are going to use it majority in people that really need this as part of the treatment for obesity or for majority weight of loss. Not so much for the summer body when someone wants to have it.
So have you had many inquiries from people who are more like they want the summer body and they want Ozempic to do it?
See, for sure.
In Ocean Medical Clinic alone, they've treated several hundred people with Ozempic already. 3 out of 5 private clinics on the Rock told GBC they prescribe the drug for weight loss at present. Like with any new medicine, there is still a lot to learn, but despite the supply issues, the demand for the drug seems set to continue.